Vice Chair, would like to call the meeting to order.
Sure. Do that. Can I get a motion to call the meeting to order? Oh, thank you.
Second.
All in favor, 9:07 for the record. Friday, March 11th, Southern Berkshire Public Health Collaborative meeting. I did send out the agenda in minutes, and we have copies today. I'll help you out with back. We're both really tired today.
Where's Pat?
I'm not sure if there's any comments, questions, edits anyone would like to make on the minutes. If not,
A motion to approve the minutes as submitted.
I'll second. Oh,
I
everyone's
got
good.
it.
Oh, good. Yeah, all right, that sounds good to me. Okay, moving along. This is sort of me. So updates from the last meeting, we presented the intermunicipal agreement draft to the host community town of Lee Select Board. We met twice, actually. We met once, and there's a little bit of a language change, nothing earth shattering, just really within the indemnification clause to make sure all towns are protected if something were to ever go really south. And so we made a small edit there, but I will say if it comes up when we start to present the stuff to the select board and board of health, there's very minimal risk of holding this collaborative the way it's set up with this intermunicipal agreement. One of which, we have nurses that have liability. The town of Lee, as the host community, carries a $2 million liability clause as town of Lee employees, which we're covering those costs through the grant. Our medical director has malpractice coverage, which Dr. Kenny he's carrying that himself. He's not getting paid any extra money to carry that malpractice. We have the mass tort claims law that protects personal liability on public health people. We have any work that the nurses are doing are approved by DPH SOPs, standing orders, and we're not setting policy. It's different where if you have a board of health like Great Barrington passes a tobacco regulation and Big Tobacco doesn't like it and they litigate that. That's not what this collaborative is set up to do. So there's very minimal risk. And so that indemnification language is a standard set of language sets in all intermunicipal agreements. And so Lee has signed on to that. I apologize for causing some concern or confusion on the email that I sent the other day. They signed, what had happened was the Lee Select Board Chair was to sign, she was supposed to sign one set just for Lee and then sign the master to be sent to the other towns. And she signed both. And I'm like, there's no place for anyone else to sign off on. So I did send check your most recent email yesterday. That would be the intermunicipal agreement to move along. And, as you advance that, ideally, it should probably go to the select board first. Most likely, they may refer it to their council, then come back. And then you would probably want to move that to your board of health, but it's really up to you to decide. I think between Mike Hugo, hey, Mike, how's it going?
Good. How are you today? And I'm sorry, my tux is in the closet. I usually get dressed accordingly,
Okay, don't feel bad. We're in the same position today.
And I won't stand up so you can see my jeans, I promise.
But oh, so you got pajamas on.
No, these are not pajamas.
But so there's going to be plenty of support when you need it, if you need it, when you start to advance things between Jane, myself, we have Mike Hugo, we have Cheryl Sabara. I'm not sure, Mike, how much longer Rich is going to be involved in.
Rich is going to be, he's been sentenced to pretty much a life sentence with us on these.
Okay. And so we do have the PowerPoint that Cheryl presented on back in, I think, December, and I think we'll just take your lead, present it. And then I will say that KP Law, which I don't know what other towns have for legal counsel. So Jeremiah Pollard is town counsel for Lee, but he also is town counsel for Otis, and he may be in a couple other towns. And then KP Law is a town council for like Lennox and a few other towns. They actually participated in the IMA. So unless you got some outlandish town council that has no idea what they're doing. And I think if legal questions come up, I would utilize Mike and Cheryl to help us navigate those waters. It's probably going to take a little bit of time to navigate this IMA, but like whatever folks need from the team. And again, it's very town friendly compared to some of these other IMAs I've seen. It's 3 years. It's easy to join. It's easy to withdraw. We're not allocating dollars for the outside of the grant. I mean, yeah, we're working kind of behind the scenes on like some of this V&A money, but that has nothing to do with the intermunicipal grant. The entirety of the grant is covered with regard to the IMA, and hopefully we can get it all signed. And that just kind of solidifies it lets the state know that these towns are serious of sharing services and whatnot. And it kind of just shores up, hopefully, the money that will just keep coming over a long period of time. And again, these are just standard IMAs. It shouldn't be anything town should be afraid of.
And then if you have, if you know you're gonna be presenting it to your select board, if you could let me know and then, like Jim said, Jim might come, the nurses, we might invite, Mike and
Cheryl and Rich,
so whatever supports that you guys want, just let us know when you're gonna be presenting it. And you can decide what level of support you feel like you might need for your individual town.
Well,
We're
voting on it tonight.
we're willing to come in to any, if anybody needs anything with their select boards, we will actually attend your select board meeting with you if that's what you need.
Excellent. Our Board of Health is going to vote on this tonight. All three members Jane was at our meeting last month. We do have to improve the transmissions from the pike. It was interesting. Jane would say something and her mouth would move, and then half a second later, it would all kind of come this way.
Yeah.
So
Yeah.
it's really weird, but so they're on board with it. The select board is going to have it on the agenda for their next meeting, which is a week from Monday. So.
Do you guys, go ahead, Scott.
I have a question.
Sure.
So structurally, is this only pertaining to the shared services grant?
Yes. Yes.
Well, yes and no, actually, Jim.
What
Structurally, the agreement itself has been set up with the ability to add exhibits or riders to it. So you could actually, once you form this, once your group gets really formed well and is functioning on the public health excellence grant real well, if you see a HRSA grant, or if you see that there's something from SAMHSA or something from another bureau somewhere, state or federal, any kind of money, Robert Wood Johnson Foundation, anything like that, you can attach that grant to this agreement as just adding a rider to it or an exhibit to it.
Does that have to happen every time a new grant?
No. This is just the formation of the collaborative.
Yeah.
And I apologize. I don't think I understood the question. So like under Exhibit C, that is like an addendum of what we're currently providing. But if the collaborative, say, for example, we get more funding and hey, you guys want to have a backup food inspector, we don't have to go back to the towns and amend the actual agreement. We can our group can change this Exhibit C anytime we want. So this is just the formation of we're getting grant funding to get this up and running. But this is just a reflection of the collaborative and our functions.
And this sets up the fiduciary agreement, right?
Yeah.
So the town of Lee.
Yeah.
Tri-town manage it in a separate account. So then I'm just trying to understand it. Like, so when you mentioned, so other funds like public health nursing funds that come in or funds that come in from towns individually.
Yeah.
Do they still go into that account? Or
We
are they still under?
So we have one shared services account, but we track every piece of penny that comes in.
Right, but he's talking about independent things that the towns are getting separate.
Yeah, we're tracking that individually. So for example,
They're part of the,
Right.
those services covered by the IMA or part of the IMA, or they're two separate things?
so So there's two different things going on. We have the $300,000
Yeah.
grant that we're getting that's helping us set this up. We have to set up the intermunicipal agreement, the form of the collaborative, the governing board, the fiscal host, whatever. We report all our expenditures through the grant on a quarterly basis, staffing, travel, whatever. Outside of that, we're working with towns to try to repurpose the VNA money, but we're tracking that money too. So for example, Otis is giving us their appropriated VNA money. We're putting that into a spreadsheet and we're allocating additional resources for Otis outside of the grant. But we don't track that money to the state. That's just local.
Yeah,
We have to report the DPH funding.
do I understand?
No, it's.
So does IMA cover whatever those services are, even though the funding is separate?
Well, the IMA is just a standard IMA that puts the towns in agreement that we're working with each other.
Yeah,
But then, so for example, Sheffield's gonna give us their money. Outside of the IMA, we have a separate contract with Sheffield that we're gonna spend extra money on vaccines for them. And education and outreach supplies. and tick-borne
Oh,
illnesses.
so that's outside of
Yeah.
it.
Thank you.
Yes, the IMA is just a structural agreement.
That's still the agreement with the collaborative.
Juliet Haas is it, Juliet's it. So yeah, so there's two different things going on. The IMA is just a structural component that sets up the fiscal host in the services we're providing through the grant. So we're providing all the comprehensive public health nursing services
Yeah,
as part of the grant. This just is the piece of paper that reflects the collaborative. So like, if New Marlboro wanted to pay us to do inspections down the road, we would set up a separate agreement outside of this IMA that reflects what we're doing for New Marlboro separately outside of the grant.
okay.
Or, for
So
example,
with the town, like, so for example, I mean,
No.
If, the town that's not even part of the IMA wants to hire the collaborative to do something, it's just a separate contract.
yeah, and this board would come together and make those decisions. So one of the things that, and I think we know, I've already said this is a collective inclusive body. So for example, a town wanted to join the collaborative, which Jane's going to talk about in a few minutes. We're not going to unilaterally behind the scenes say, yes, we're going to bring this back to the collective board and say, hey, we have a 10-town IMA. Sandusfield wants to join the collaborative. We would bring that back and see what that would look like. And then they would sign the IMA to add on to the pot. Well, it's no different than how the alliance is set up. They have a 25-year IMA that's locked in and there's 30 towns on it. People come in and out, offer just withdrew. So it's just, the IMA is just an agreement of the towns to reflect the relationship. That's all that is.
But if a town wanted to pursue a grant on its own,
Yes.
then it is not part of the collaborative tracking or anything else. I think that was another part, maybe Scott's question. So if you had an item that you were getting funded for, that's not part of this, then that belongs to the town
Right.
on its own.
You're not giving
Kind of like your
anything up.
FDA like your
Right,
FDA
exactly.
Okay,
you guys will sign that, you'll get the money, and then, we have what we wanted to do with that money, but, that would belong to you. It's not reflected necessarily in the IMA. Because,
But there's language in there that, so just so everyone understands, we're not writing grants on behalf of towns.
That's right.
And it's actually in the intermunicipal agreement that the collaborative must seek approval if include, so for example, a new grant comes out. We're not going to just write a grant for the 10 towns and say, hey, we're writing a grant. You have to give us permission to do that. We're not writing grants on behalf, which is a little bit different than some of the other IMAs that are out there.
Right, and the other thing too is that if we get a grant separate from the collaborative, and then we want to hire the collaborative to do that, do services in that grant, that's also That's not this, that's a separate,
It's a, yeah, it's a.
that's a separate thing.
What we don't want to do right now is muddy the waters with this intermunicipal agreement. You know, you have to remember, like, comprehensive public health has a lot of moving parts.
Right.
Like, I don't know how I even survive on a daily basis at Tri-Town doing household hazardous waste. There's so many things that go into it, but rest assured, we have a secured revolving account that tracks every penny that comes into our organization. So if we track the $300,000. And what I'm gonna do is at the end of the fiscal year, I'm gonna go over all the revenue expenses with everybody as a board. So you see exactly what money is being spent on.
And then we
Yeah.
can bring that back to our board.
Yeah.
Yeah,
Yep.
but we're also getting extra money outside of the grant to enhance what the grant can't cover. You know, we're getting $300,000 a year. We know that we're launching a vaccine program. Right?
Yeah.
We know it's gonna be super expensive. If we're gonna take on the schools and all these other things that no one's doing now, there's only so much money in that grant that can cover that. So places like Otis, Monterey, Sheffield, even Tri-Town and Alford approved some extra money. They're gonna give us that money. We're gonna have a town by town tracking of what we receive and what we expend and what the balance is. So if we buy a lot of vaccines through that equalized valuation chart that I sent everyone, we're gonna apply those costs, and whatever's left over is left over. Then I'm gonna come back and say to Sheffield, hey, there's a couple $1,000s still in the account. Do you want to do some outreach education? It'll be specific to that town. The IMA is just the structure and the reflection of the collaborative. The collaborative will decide what the collaborative wants to decide outside of the grant. You know, we get a Robert Ward Johnson the grant foundation, and we want to do X, Y, and Z. We would bring that to the board, and then we would write the grant.
Yeah, just.
Yeah.
I'm not questioning.
No.
anybody, right? Pieces.
There's a lot of moving parts,
Well,
yeah.
and especially as we go
Well,
and to explain it to your
yes.
select board, they're gonna
Yeah.
have these questions, and it's
Exactly.
good for
Yeah.
us to know.
Yeah.
Yeah,
Is it safe to move on to quarterly training topics?
Yeah.
James,
So,
are you?
yes, quarterly
Okay.
training topics.
No.
so we're good, Scott? I mean, yeah.
Yes.
Yeah.
Good on that. Two more quick questions on IMA. Exhibit A and Exhibit B. What are they? Because they're not attached. Is A like it's 1, 2, 3, 4, 5th whereas? I already got a question. for
Oh,
you.
you're right, I have exhibit C, not
Administrator.
A and.
Is it something that gets input later because it's a certified copy of select board meeting books?
What page are you on?
Oh,
What?
yes,
The
yes.
first page.
Page 1, 1, 2, 3, 4, 5th whereas. Right before
It
now.
has to
there.
be done at the select board meeting. You have to certify the
Right,
minutes of the select board meeting, and then it's added to
Therefore
the.
contained
IMA.
in exhibit A.
so it doesn't exist there
Right.
now. Just confirm, because I already got that question.
And then B is.
And
what-
B,
is at the
the
top.
next page, right, top first paragraph, which is
Oh, the terms,
program agreement. which
that must, maybe
already
that's, the-
exists. Sorry, not sorry, but
no,
Well, exhibit A, I think, is the IMA. Mike,
No, it's the,
No. This itself is the IMA. Exhibit A is, I don't have all the exhibits here for some reason.
is this
okay, that was the point that was brought up too.
exhibit A, I thought was the minutes
Yeah.
that certified where the select board signs.
oh,
And you
okay.
can't have that until the following meeting where the minutes have been approved.
Well, I
And
guess,
then once that happens, that gets attached.
yeah,
to-
so the final thing, it gets recorded with like the clerk and stuff. Oh, okay.
Right,
So-
but the B, I'm not sure. of. Where was the B?
Second
And-
page, second line, third line. Right.
Uh,
Looks like an agreement between Tri-Town and Lee.
it looks like it's the PHE grant.
let's see, will coordinate, managing, direct the activities of the parties with respect to the subject matter of the grant program. This agreement in common with the match attached here too as exhibit B, the terms of which are expressly incorporated herein and shall bind all, well, I would think it's the IMA, right?
No,
Exhibit with.
No.
Public health grant.
it's the public health grant. It's the actual grant.
So we're.
Those terms get conveyed into the sign.
Oh, probably so we have,
That's
we have
the
signed
one.
contracts and stuff. All
But
right,
this, I think that this is like the grant that, the PHE grant that was granted to,
Start this. whole
okay,
thing.
so we have that.
yeah.
Yeah,
right.
we
So
have
we
a,
would need that.
But we'll need to have that for them as part of this. for
Yeah,
them to sign.
yeah, I mean, I can, if that's a sticking point right now, I can get all that, but
Yeah.
we have a signed contract with the Commonwealth.
Right, that's,
Yeah,
that's
yeah,
right.
okay.
It's
Right, so-
basically saying this is where we got the money to
Our
start this whole thing.
Select board said, you know, where's A and B?
Well, no one said it yet,
So.
but
Even if it's a huge thing, if it's a whole contract, if there can just be
No, it's one page.
A with a, I don't know. how-
I have that. I'll, that's, wow, good catch, Scott, because I
Explain
haven't,
what fills
I
in
looked at
there
this about
so that-
30 times, I didn't see that yet. I mean,
Yeah, take it to-
But I have all that, yeah,
Okay.
so with the executed agreement with the Commonwealth, yeah. Okay.
Thanks. Got it.
I'm glad that we didn't move on.
All right, so on to quarterly training. So one of the goals that I've had is to do a training quarterly, send to the quarterly training. And so I wanted to ask you guys kind of what you were interested in. Like, one of my food trainings that I thought would be like to do something on how to do how to like figure out which sanitizer strips should go to which. And then we might also do like how to calibrate
Thermometer?
a thermometer.
Gee, that'll take 15 seconds.
Well, it does take 6, unless you're like, unless you've never done it before. You know, we could learn to do sushi rice, like, you know, whatever's, which might be mostly relevant to the 4 biggest towns. But like, so that's one option. The second option, we could do some things on like housing and writing and like orders. So that's something. If we wanted
Did
to.
we do that this afternoon?
Do you want me
You
to
know.
send you my generic order?
All right, never mind. I'm just in the middle of writing it up.
Yeah. I'll
Yeah.
send it to you.
And so on and so forth. One of the, just the word to the wise, one of the future trainings are going to be training on first responders and like, especially with health inspectors, when you come across a situation, especially that's dealing with substance misuse, and like what we can do to not make the situation worse. So I'm just asking the towns, like, what is it that you would have some interest in? I can send an email, but I want you to start thinking about that.
Okay, so the first being, I just realized that my soil evaluator license is expiring. And so maybe some local continuing eds for soil evaluators. And then looking back to this email that I got from UMass Lowell, I think it's an advertisement to have this company or this instructor come to your town to teach CPR, first aid, stop the bleed. But what I'm most interested in is the bloodborne pathogen training for body art facilities.
Cool.
Yeah, so I can, maybe you guys got this, but anyway,
I
it
didn't
doesn't
get
have
that
to be that
Mhm.
instructor at
Yeah.
UMass Lowell, but definitely having a local bloodborne pathogen course would be helpful.
You know, and also too, one of the things I could add to the mix as well is, and I know we're gonna try to figure out like what your priorities are for nursing and as we move that along. But like, for example, Ellie had asked me to accompany her yesterday on a housing inspection, just not as an agent or whatever, you know, just as a partnership kind of thing. And I want to offer that up as well. I think there's a lot of experience at the table and, you know, assuming, you know, schedules work. If you ever need a hand on looking at a set of plans, looking at an order, I mean, we all talk to each other all the time anyway, but if there's ever an opportunity to bounce other ideas off each other, you know, don't be afraid of that, because part of what we're trying to build here is relationships and collaborations and not getting knee deep into, you know, I'm gonna charge you this, you're gonna charge me that, like, there's services that will be providing that are gonna cost dollars, obviously, because you have to pay staff to do that. But I want to make sure that we're building that kind of relationship as we move along. And I know we keep talking about that listserv, sharing of documents, which we still need to sort out. But many of us have talked, Scott and I talked, Rebecca and I talked, Jay and I talked. But I want to make sure that we keep that natural, organic relationship building going, because we can all learn from each other. And again, we have tons of housing, violation cases and letters and templates and stuff, which I think, we'll want to utilize. And Amy and I were on the phone the other day on a consult on another housing issue. And I want to just make sure that we keep that on the front burner of this organic way of working with each other, because we can all learn from each other and stuff.
It's like a group mentoring in a way.
Yeah. Shane, is your new email jsmith@triton?
No, it's Jane at Tri-Town, Jane with the Y in the middle.
Rebecca, I don't know if this is something Fairview is offering, but I've been trying to get in touch with their health education department. They have both for internal, and then they also, of course, have public trainings. Stephanie Pasquarelli is the current coordinator, and she's out on leave right now. I've been trying to get information about, they do have some trainers, I guess, that do choke saver or do first aid, but also could do choke saver. But then I wonder if, I presume they have bloodborne pathogen training for their staff, and whether that's something they'd be willing to share with the community is a good question, maybe.
Okay.
So anyway, I'm adding that to my list of things as I'm trying to get in touch with them, like in a concrete way. So I will add that to the list of things if you like.
Yes, and I didn't know that they did public training, so that's.
They did before COVID, and then COVID sort of locked that down. And then, some of it is more like what Heather Barbieri would prioritize around sort of emergency first response stuff. Some of it is more just other things, like maybe like choke saver kind of thing specific to the local community needs. So yeah, I don't know anything about sort of what their priorities are, and they don't even have their sort of public offering schedule developed for the year yet, I guess, because she's been out and they've been trying to figure out with COVID whether they can actually hold things on site. So
I think now is a good time to nudge them about okay, maybe we can think about some other things that we've put on the back burner for 2 years and
for
get a
sure.
list out for the spring and summer. So thanks, Amy.
Absolutely. Yeah, like I
send
even
these
needed to
to you.
update my first aid CPR, and then I wanted to become trained as a trainer, and she didn't really have an immediate resource for me. And I thought, oh my goodness, that's interesting. They're not sure if they're going to be offering it, but they've been getting questions and people have been asking for it. So yeah.
And if we can assist with like helping push it forward, that might be like a good icebreaker, for them to start that program again. So
yeah, I don't know what the hangups are other than she's in charge and she's on leave, but there might be more to it.
And I did have one more question, and this might be a question for Mike as well, as we start to build capacity and qualifications and certifications. And Mike, I know I brought this up before, Rebecca brought up the, refresher for soil evaluators. There still isn't significant inequity issue out here in the Berkshires on accessibility to some of these trainings. For example, one of my guys had to go to Lowell, John,
really nice to
multiple
not drive that
8
happen.
weeks in a row to
For
do the
all the
soil
trainings there.
evaluator class. And so we need to bring that out west of Springfield and Worcester, Mike.
You're not kidding.
And I will tell you, for someone that got my soil evaluator license 100 years ago, it's not a slam to Newey Pick, who is contracted to administer the DEP soil evaluator requirements, because they don't have a lot of jurisdiction other than issuing the licenses. They offer limited slots at reduced cost for boards of health. It's usually $1,000, but there's only so many slots available. Then the amount of time and dollars, that I have to absorb through my Tri-Town budget for travel, backfill, overtime. It's a 20-hour day, by the way.
Yeah.
But you have to be at the class for 8. He's on the road at 4:30 in the morning, and then he gets out at 5. He's home at 9 at night. I have to pay for that. You know, for
Can you talk
through-
about Washington? 'Cause
through my
they're-
operating budget. But like, I just want to make sure we're advocating, Mike, to make sure that these trainings are working their way west of Springfield.
Yes, and that's something that is going to happen, and there's a lot of discussions about that are taking place right now. The ARPA funding, which is separate from this money for the Public Health Excellence Program, the ARPA funding has tens of millions of dollars in it for trainings, and they're in the process of completely redesigning how the trainings and certifications are going to be rolled out across the Commonwealth, and they're going to be there's a lot of awareness and concentration on making sure that it happens in Western Mass. So you're going to get closer, but what you should know from this funding is that if you are sending people to trainings, and that includes anybody who's getting trained on anything under this grant, all of the travel is paid for. There was a soil evaluator course that Miha has been running, I think in 2 or 3 different locations. And we sent the inspector, I am the grant administrator for the islands, and which is real handy considering I live in Framingham, but I'm the grant administrator, and we sent our inspector for a training off island that took place this week for soil evaluation for Title V actually training. And it started at 8 a.m, and logistically it would have been a nightmare to get her there on time for the start. So we actually sent her up the night before, paid for her hotel room. We're paying her mileage, and all of her expenses, her meals and everything else are coming out of the grant. And she's going to go do a 2-day program on certified pool operator, which is in Wareham. And that's off island, starts early in the morning, both mornings. It's a 2-day program. So she's gonna go up and stay in Wareham in a hotel, and her mileage and meals are paid for from the grant. And you can do the same exact things. If you have to send somebody and they have to wake up at 4 a.m, that's insanity. You know, so you send them, you let them stay wherever it is, and then they do the program and then come back. It's crazy to do that to somebody's body, to send them out that far. And the state's aware of it. And I think the more, to be honest, the more that they see mileage charges going on to the grant program, the more they're going to say, hey, wait a minute, why are we paying all these mileage charges? Why don't we just drop the program into the middle of where all these people are? So there's all kinds of reasons, sort of off the book reasons why you might want to start to send people out.
Yeah, sure. But our grants we don't have a paid inspector right now through the shared services grant. It's all public health nursing. But and there's only so much in our grant, by the way, just so everyone
Well,
knows.
that's what I was gonna ask. Is this in addition to the money that we've already allotted to, or do we have to budget training in to the $300,000?
So right now, the 300,000, and I can show you guys the budget. It's mainly all staff. It's Amy, Jill, benefits, very little dollars for Jane's limited position. There's like 7,000 for mileage, 7,000 for support. That's it.
Amy, didn't know you're going to be.
Now, I will tell you that I will tell you though, we did pay for a few of the towns to go to MHOA and travel within reason. And so what Mike is saying is, yes, the shared services grant can be utilized for that. It's just our grant right now is structured to shared nursing. I hope as we evolve, it will turn into other opportunities that will benefit the collaborative, and we'll have to look at that.
What we're hoping is that this other granting that's coming, they're talking about the training and all of this stuff. My only hope is that they realize that Worcester is not Western Mass. And Amherst is a hell of a ride.
It is.
I will say, I've talked to Vicky Spocus, and my farm has 3 very different soil types and a change of parent material.
Well,
So
aren't
you're
you
volunteering.
special?
I have volunteered
Yeah.
for,
Yeah,
Well,
but that's
it's-
what I need.
but that's
Yeah.
exactly what they need.
Well, it's funny, but
Sheffield Clay.
years ago, when I was working for Peter at Tri-Town, we actually had a partnership at BCC where
Right,
Peter and I actually taught wetland soils for CEUs over the time. You
right.
just gotta find a property and
property.
make sure there's no like liability issues and whatnot. So there's opportunity for us to do things out in Berkshire County. It's
Yeah.
just hopefully as we come out of the pandemic and we kind of wake up a little bit, because I've been in this fog for 2.5 years, we're gonna start to do different things.
But we're not talking about the grant right now. We're just talking
No,
about
no, we're just talking about trainings.
supplemental trainings
Yeah.
that the collaborative
Yeah.
Right.
Well,
provide.
I'm wondering though, look, let me take that back to Sam Wong, because I'm wondering why, even though you have a primarily nursing grant, I'm wondering why you can't still use grant money for other
We
trainings.
can't, we can, Mike, but there's not enough in there to do it.
We have to
Oh,
revise.
okay.
That's the.
There's
And
not
one of
much
the
in there.
things that we use to sell this whole collaborative to towns were to get a secure public health component, which we can't be taking money away from it and say, oh, well, we've done this for a year, but now we're gonna cut back because we're gonna train something else.
Now give me
So-
$400,000 a year, Mike, and I'll be all over multiple things.
Yeah, talk to Sam about that.
Yeah, talk to Sam about that.
Well, the other thing is though, some of these trainings you're not going to be doing in the next couple of months anyway. You're talking about a little down the line. And by the time that you get to those trainings, the state's going to have all of that ARPA funding figured out. And you'll be able to draw from that. You're not going to have to be paying for trainings if you just let them get their system in place. I'm telling a lot of people right now on these grant groups not to purchase any software for, like, a lot of towns are getting into this whole thing with carrying the tablet and checking off the mark instead of using paper for the inspections. And I'm telling everybody, hold your horses, because the state's going to buy all of that for you. So right now, if you're spending your money on it, you're wasting your money, because the state will spend its money. We've got money for that in the ARPA funding.
So for example, if we needed like 5 computers to run a flu clinic, you saying there's money coming down the pike for that?
Yes.
Oh, okay, there we go.
I'll need something for my person.
All right, let's move on.
Okay, so Board of Health training, inventory and needs
Yeah.
assessment.
So, actually, so I'm gonna contact each one of you and just say, go through, just a conversation. It's probably gonna take half an hour, just to see like what areas you think you might be interested in for like mentoring, right? Having, seeing if we can get different towns together to do an agreement, like with food inspections or, or housing or whatever, camp inspections. And so there's like this whole continuum of each and every subject and kind of where you're at, whether you have your training, like whether you currently meet like the standard. And so that report that comes out of that will inform a lot of what we're gonna be like focusing in on as far as like, trainings that we're offering, working together to see if some, to see how we're gonna all like build each other up and like build capacity.
Well, I think that will help too, to look at some of the training needs that we may be looking at further down the road.
Yeah.
Gaps.
Yeah.
You know,
And then Amy also has a process, and I'll let her speak to that with public health nursing. And that would be probably would be some of the Board of Health, so that would be some crossover, but also, and I'll let her speak to like, talking to like the Council on Aging and getting some other input on the public health nursing piece as well.
Can I just add in my 2 cents about the needs assessment? I wonder if we can like add a column to that of like individual towns offering like what our strongest area of public health is. Like Scott might say Title V, or Ellie might say food, and then to weave in the puzzle piece, like, oh, Great Barrington needs help with food or Title V. Scott, can you mentor? And then, so that's it.
Yeah, that's a great idea.
That's a totally good idea.
So like not only what the needs are, but also what you have to offer. That's great.
And that-
Jamie? When
Yeah.
when you do your surveys, talking to the people, the sessions you were just talking about, where you're going to be calling around talking to people, make sure that all of the health directors have advance notice that you're going to be needing to get something about everybody on their staff, everybody from the person who steps up to the desk to help people that come in for a form, right on up through the health director. We're going to need to know everybody's, all of their certifications that they have, and all of their special trainings that they've gone through, because there's going to be a humongous needs analysis that's going to be rolled out starting in a couple of weeks. It's going to be, MHOA got the contract this past week to do that. And it's basically going to be a capacity assessment for the entire state. And then when we get all of that data collected, DPH will look at all of the data across the state and we'll say, okay, we have a weakness in RSs. For instance, we don't have enough RSs. We have people doing work that an RS could do. So now we need to purchase 716 RS programs across the state for people. And we'll need to purchase 406 Title V certifications and all of that, because that's part of the ARPA funding, the budgeting for that is to determine what the needs are across the state, and it's very detailed.
Okay, so I'm the MHOA rep for Region 1, so I'll check with Dawn and see if I can see what their paperwork looks like and see if we can do it all in one fell swoop to get the information they need. I mean, it's funny because most of the people that are taking the form are also the people who's going out on the inspection and writing the letter in Berkshire County, but it would be good to capture that that's the case.
Right, and that's going to be done. I don't know if you folks know Brian Murphy Eustace, BME Associates, but Brian is going to be the consultant portion of that for MHOA. That's going to be actually pulling together an army of people to deploy across the state to do this.
Great.
So you'll be seeing more on that. Just a heads up. If I didn't raise it right now, you'd say, well, he sat here, why didn't he mention it? So I just mentioned it.
And we'll make sure we want to talk about the nursing piece too. Like Amy and Joe come in with a lot of credentials and experience, but we want to make sure that they're part of that conversation too, not just the health agent stuff, because there's probably things that we want to do with the nurses as well. Like Joe.
Well, it's everybody, Jim.
Yeah,
It's everybody that touches that department.
Yeah.
One area that I know that we are in general weak on in Berkshire County is the emergency management piece, like getting all of those very basic courses.
Oh, the ICS and stuff.
Yes.
I mean, maybe at least for board members, maybe not for the people that are sitting around this table.
No, I think I
That's
failed
right.
the ICS 700 twice before I passed it. So you can include public health agents in that too.
But does anybody here have the weapons of mass destruction
I do.
certification? I
No.
do too.
Oh, wow. So,
So I guess we're that team.
Right.
Yeah.
so there's gonna be a lot of work on that, it sounds like, and we'll try not to overburden, but I think it's really
It
important.
was.
And especially maybe what Amy and Jill are gonna be bringing to the table of finding out specifically what the needs are for this group. It will be kind of exciting to get that and be able to work with
I
that.
feel so old, Ellie, mentioning that
Yes,
training.
right.
I feel so old when you just brought that up. That was one of the first things I did when I
I know,
started
but we're
working.
sitting there going, really?
There's a train to trainer class. Oh my God, so painful.
Really?
All right, cool.
All right, so that's it, that's that for that.
Okay, Amy and Jill, COVID update.
Well, just first of all, just to acknowledge, I don't know if folks noticed the numbers, as we predicted, we saw a little blip in our local South County numbers post February vacation, unfortunately, and then it was also the first week that folks really, I noticed visually started to unmask more and more. So we're going to be riding these blips for a bit. It's been helpful though, I've been, as I sit in different meetings, trying to hear how sort of the community as a whole is responding to changes in policy at the state level, at the Department of Ed and early ed, and then local town mandates or advisories or directives being released. I am hearing about anxiety. I am hearing about confusion about what's safe and for whom and why. So it has, for us prompted sort of a concerted need. And then also in the vaccine equity grants, or that's always on the table, who are those who are sort of left behind as we all move forward through the next phase of the pandemic. So that prompted us to secure thousands of masks that we are going to be distributing starting today. The site list is up to 30 now across all of our 10 towns, with a focus on food pantry locations, low-income housing, community centers, libraries, senior centers, town halls. I don't think that's it, but that's a lot of it. And I've been developing health education materials, specifically just practical masking information, because I think there is just a lot of confusion. Who should even be thinking about a mask anymore? And just trying to sort of meet people where they are with that information. The other thing that I'm developing, and I was on the phone with Peter Dillon at Berkshire Hills 2 days ago, and I'll be reaching out to Southern Berkshire, Lenox, and Lee, they're at the district level. I confirm with Department of Ed and with NEMA that there are absolutely no resources for youth-sized KN95 masks in the state, 0. And the reason I wanted to confirm that is because not only do we have some kids who are at higher risk for medical reasons, we also have a fair number of household members or nearby loved ones in Berkshire County who fall into that category. And so when those are the kids probably who are still going to school wearing a mask, but in an environment where no one else is masking, or maybe 3/4 of the student body is not masking, and we still have COVID in the community, that little surgical mask or cloth mask is really useless, to be frank. So the survey that I've developed, and I've just sent it to Alana at VIM and Deb Phillips to vet for me, we'll send out to the families at all these districts, trying to identify households for whom purchasing a youth KN95 mask is too expensive. They're about 50 cents each. So on a day, every day for however many months before things really drop down to 0 or very, not 0, but very low through the end of the school year maybe. And also to see who might be interested in receiving a call from Jillari with tailored mask guidance for their family. So we're targeting the families who have kids in school. The school districts are sending out communications, but they're broad and people do have questions. Even in my personal life, going around to different healthcare providers, I observe that information about how masks work, why, and who needs to wear them is very spotty. But if you go onto the CDC website, where it says, oh, the community is at this level, then these people should consider masking or not, it always says talk to your healthcare provider. The healthcare providers don't necessarily have that information. This is specific to those of us who've been really doing that part of the COVID mitigation all along, learning about the science around masking, the research and the particulars around it. So that's something that's going on. We're in the middle of that, and hopefully, my goal by the end of next week, have all the adult masks distributed and all that education, and in the next couple of weeks, have people be able to call Jillari and start to help them with that at the school level. At-home testing or testing in general, I don't know how many folks are aware that the Berkshire County is not included in the extension of the Stop the Spread funding. And who does that impact? It doesn't impact folks who are insured, right? They can still go and get a test. But what I haven't figured out, and I need to call the COVID hotline to find this out for VHS, is if you are asymptomatic, so Stop the Spread, the whole intention was to provide easy access, free testing to anyone, asymptomatic or not, exposed or not. That was the goal of Stop the Spread when it was rolled out last summer. And so if everyone now is expected to get tested through insurance, are there barriers around, do you have to be symptomatic? Do you have to have a known exposure?
With Blue Cross Blue Shield, you do. You have to be.
That would be my guess. So, there are other resources available. I've confirmed with the local pharmacies that anyone with private insurance or Mass Health is eligible through a federal agreement to get up to 8 COVID at-home tests if they requested the pharmacy counter.
Is that per month, Amy?
Per month,
Yeah.
per person.
But they have
However,
to pay for them.
some few insurances, Blue Cross Blue Shield is not one of them. Some few insurances require you to pay for at least a portion of it up front and then submit for reimbursement. Mass Health does not do this. It's free over the counter or over the pharmacy counter. Blue Cross Blue Shield, as far as I'm aware,
Right.
you get them right at the moment. You don't have to pay anything. There's no copay or anything. Medicare is not yet rolled into that
That's
program, which they have since January had communication on their website. This is coming. This is coming. It's not yet in place. I called CHP. They do have up to 2 tests per person available for anyone who walks in the door of Family Services while during their open hours. And we now know that there's the federal a renewal of that program where you can go online and request 4 tests per person in a new distribution through the mail. Which I don't know, I just got mine 2 weeks ago.
I just got mine too.
Yeah, and I submitted
I
the
got mine
first
too,
week.
yeah.
It was-
Right.
So, that is down the line and we're looking at what do people need right now? And I don't know how soon, so the Stop the Spread funding, I believe is at the end of March it will end. So up until then, we have asymptomatic testing for whomever through the sites, and I don't know what DHS is going to do in response to this. They may have their own community funds to continue that for a little while. But we're also looking, the new phase of pandemic really is about at-home testing for the most part, and maybe confirmatory testing, or your doctor's office may have a molecular test that they can do in-house if they're trying to do a differential diagnosis and rule out something. But so those are things we're working on. And then, for each stage, it's finding out the actual current up-to-date information, figuring out how to disseminate it so that people understand.
If
What's there.
if I can add to that, Amy, I did speak with Smitty and State Rep John Barrett advocating that, it's a different situation if they just stop the spread across the state. They're not giving it a site in Berkshire County. So I advocated for that. Plus I did an interview on NPR the other day and I was like, the continuation, and Mike, you're gonna hear me say this multiple times, the inequities in Berkshire County is it's ridiculous. I can see, we all know that the Stop the Spread wasn't gonna last forever and it was going to wind down. But like, I'd be okay with it. They said, okay, we're done with Stop the Spread across the state, April 1. But we're going to continue on for all these other locations except for Berkshire County. We have senior population, we have rural communities, transportation issues, medical insurance coverage issues, and again, the inequities being presented in Berkshire County. So I did advocate to our
Great.
legislature about, at least give BHS just give us one site. I don't care where.
Yeah.
Give us one site for a little bit longer.
Well, they did it based on testing volume and not based on positive case rates, which is really frustrating because in particular, because Central County and North County do continue to have among the highest case rates in the state. So it really was, the way they based that was frustrating. So one more resource that we do have at our disposal, because we had secured a number of the bulk rapid test resources from DPH, and we still have at least 500, maybe close to 6 of those available to us there at Tri-Town. Jill and I have been talking about different ways to use that resource. Jill had the idea to set up regular 1 day a week or more within a certain number of hour, this hour to this hour, walk-in testing, or you can even sign up for an appointment. We have, as we have during our pop-up drive-through testing clinics, we can provide people with documentation of their results. So if they need it for travel, see, travel is an example, not affecting necessarily the lower income population, but there's still a number of people for whom that would be a burden to pay out of pocket for a test because they need it for travel.
I just want to put this out there because I didn't know this until a meeting. But for many of the locations for travel, they will not accept your vaccine card. It has to be the QR code. Mine, I can't get one because there's a mistake on the database.
Yeah.
But people are bringing their cards to the airlines.
Wow.
And they can't go.
So that may be something, so
So-
Jill and I do have the ability to correct those online in
Right.
MIS. You know, if we are presented with someone's vaccination card and their
Oh,
ID,
great.
we can correct errors, and I find
Right.
them all the time myself. There
Right.
are
So why don't you
multiple
guys hook up?
entries.
Maybe they can help you.
Yeah, so first
Yeah,
of all, I want to
absolutely.
invite anyone to email us with that. It shouldn't
But
just
it's
be
a
the people
resource
who
that
know
we know if
us.
somebody comes to us, we
Yeah.
can say, you can call you guys
Absolutely.
and get it sorted out. You
I
know,
would have hoped that the state would have created some sort of hotline for this purpose, because as you
You
say,
can't even
if
get
you-
211.
Mhm.
It's
Well,
horrible, and
yeah,
that's
it
what they
doesn't
want
get
to do.
through.
Yeah.
And the
certainly
Medicare part of the testing is a big deal.
Yeah.
Because there are a lot of people
Yes.
who their supplemental doesn't coverage.
Yeah,
AARP
it's Part B doesn't
supplemental
cover it.
does not cover it.
Yeah.
So they are being asked to pay full price for those 5 tests or whatever. And then apply for reimbursement.
Wow,
And then
I
they
know, it's
get a
ridiculous.
little, they get a credit card thing in the mail that doesn't work.
wow.
So,
One thing,
yeah.
you know, we're talking about not only maybe hosting regular hours for walk-in tests at the Tri-Town Health Department where we have our office. Another thing we've talked about, or maybe again, pop-up testing sites. If a town, you know, I can think of some examples. We have the upcoming town meeting season. If a town wants to host in-person meetings and, you know, maybe we're going through a little surge but it's not such that we want it, that the town has created a whole new masking policy or whatever, but people want to feel comfortable in the space. We want equitable access to that venue. Maybe we do testing out front, you know, or I don't know
yeah,
what
but
would be the
one
ways to
town
use-
meeting of Great Barrington,
Yeah, no, I know. I'm just saying, maybe there are ways we can, and I also don't know whether DPH, my guess is that they have a warehouse of these boxes of tests. They're not individual ones, they're ones that have to be done at
Yeah, they're
a
bulk
site,
kind
you
of,
know,
yeah.
in bulk, but I would like us to maybe get creative about this going forward and
well, the
respond
town
to
meetings are a
changing
big, that's a
conditions.
That's a big thing.
That's a big
Alfred
thing.
would love that.
Yeah,
Would
Mount
absolutely.
Washington would love that. I mean, we
You
don't
know,
have
and
all
we
that
have
many
the
people,
MRC
but
volunteers,
Yeah,
and
yeah.
if we can get access to more tests, we can sort of plan to do that. You know, I'm part of groups like the contra dancing community, which is open to the public, and it's a lot of very vulnerable people go. It's a lot big hit with older people. A lot of people have health conditions. It is a massive community builder and community reinforcer.
Yeah.
And I think as we go forward and address things like the mental health piece of the pandemic and the after effects, any way that we can use the resources we have to promote community building and you know, re-knitting together all the parts of our sort of torn apart local community. You know, I'm all about flexibility. Jill and I are trying to get as creative as we can. We welcome suggestions and whatever, you know, like I said, I'm willing to make those phone calls and, you know, drill down with Department of Ed and DPH and MEMA and like get the stuff out here to use it. That's the goal. So
I'm wondering if we can have this as an agenda item going forward, just how to create resources for testing going forward. And just continue this conversation and help Amy and Jill get creative and find out how to do this fair and equitably. So I don't know if it's because the testing location is in Great Barrington and we're no longer getting one, that the state is awarding us about 1,000 antigen tests. Is that just Great Barrington or
no, it's
other?
across the state.
So
Yeah.
all the communities that are no longer serviced by a Stop the Spread site are getting an allotment.
I think that's,
So-
yeah, it was the 3 in Great Barrington, or 3 in Berkshire
Berkshire
County, so
County.
that makes sense that's what.
Is that per town?
Well, that's what I'm asking.
No,
it's
no,
just
it's
Great
per site.
Barrington.
It's per
It's
site.
Great Barrington, Pittsfield, and I think. what,
Oh, the
North
3, oh, just the
Right,
site,
the sites.
okay.
Okay, so then that answers my question. So I probably should ask the Board of Health what they want to do with it, but I'm going to strongly suggest that we give our antigen tests to the collaborative to then use it for pop-up testings, because even though we're getting them as Great Barrington, we're not meant to hoard them
Right.
These
essentially for our
individual
town.
tests, individually packaged tests, right?
I don't know. I think they're gonna be, I don't know.
They might be the
I
same ones.
believe-
we
I
want.
believe they were
assume so.
individual.
Yeah, so I
I-
would make a case, when I first was considering this idea to distribute the MEMA stockpile mass in all these different types of locations, my hope was that I could secure individual test kits to accompany that, because again, if you are someone who, you know, we're looking at who does this matter to the most right now?
Yeah.
households with at least one at-risk member, higher risk member. Those are folks for whom having test kits would be really helpful, so that if someone is coming to their home or they're going to a gathering, they can ask, they can get a little more assurance that it's a safe space for their family member. So that was my thought around that. Low-income housing, food pantry, whatever, but I don't know. That's just a suggestion.
Well, I think that if we put out messaging of how to obtain one from your local pharmacy, and that's good, and or encourage people to apply for them from the federal government. I think they're getting 4 more now. But then there's the people that are on Medicaid, as you've said, that don't qualify. So
Well, Medicaid qualifies, Medicare doesn't.
right, Medicare. So
And Medicare is a much bigger.
maybe
pot of people.
having pop-up
Yeah,
clinics for where senior citizens or people that are more at risk will be gathering, like town meetings, like contra dancing, like senior centers.
Arts venues,
So
museums.
I'll talk to the Great Barrington Board of Health about this, but I think that just giving them to the collaborative to then do pop-up testings or distribute how we all see fit, since they're meant for the community, not just Great Barrington, even though we're getting them. I'd like to talk about that. But then I just have some bullet points. Does anybody else have anything based on what Amy shared? I'm worried now that testing is moving more towards antigen tests, that we won't get an accurate depiction of COVID in our community. And I don't know really how to think about that. I mean, I know we need off ramps. I know we need to think of endemic versus pandemic, and maybe we need to start thinking of this more as the flu, and it's not realistic to track every single COVID case. I don't know, but I am worried that there's going to be a significant gap in what's actually happening in the community versus what's reflected in our state tracking. And I was just wondering what everyone else thought about that, or if there's anything we can do locally to cover that gap.
I
Or
think realistically, what is going to happen is that since both the state and the CDC have said that their tracking method is who ends up in the hospital, who ends up in the ICU, we're not going to get anything other than that, and we're going to have to wait for the hospitals to crash. And that's really unfortunate, because as I said earlier, that's a very different point of view as to what I think for public health. I'm concerned about people in my community being ill, not whether or not they are necessarily going to end up having to be in the hospital. But that is clearly the parameter that's being used. And I don't know that we're going to be able to offset that.
well, in public health, we're charged with installing preventative measures. So
Right.
if our tracking methods only tell us when we're already in the red zone, already in a problem
No, I totally
scenario,
agree.
then it kind of renders us pretty
Yeah.
useless. And
But we're
I don't
really
know.
swimming up an uphill stream here with the fact that what the conventional wisdom is how busy are the hospitals?
And now that the Stop the Spread sites are going away, we're not gonna be able to
gonna be even
use
worse.
our percentages of positives are gonna change too, right?
Right.
one thing that I've been thinking about since, honestly, the fall of 2020, when I first started to research this, that's when, so 2020 was when the Massachusetts firm BioBot, in the spring of 2020, started to do wastewater testing and to really figure out what they could find out and what was that, what different kinds of viruses were being shed in the municipal water supply, and how they could best gather that data and use that data. So by the fall, we already had, of 2020, we had some college universities using it in Massachusetts and in other parts of the country, by the way. And so I started looking into it for the healthcare organization I worked for at that time. But in the year and a half since then, we know that there's been a CDC grant that has then allowed the expansion of this almost entirely in eastern Massachusetts, unfortunately.
Well, and in Pittsfield.
And so Pittsfield was added this maybe 6 months ago, I want to say. And
A
then
little bit longer.
maybe a
bit
little
longer,
longer,
about a
maybe
year.
around-
Year.
Okay, so they've
About
had
a
that
year.
with Pittsfield, which tells us something about the county, but we know that what's happening in Pittsfield may be quite different from what's happening in Great Barrington. I tend to keep for Great Barrington, I actually tend to keep an eye on what's happening in New York City, because I think about what's going on down here, and I do believe, so because it's not just COVID that we can learn about through wastewater testing, and because recognizing that's a fairly new rollout of technology and more broader dispersion of that technology, I do believe that that's going to be an increasing investment across the country. And so I would like us to keep our eye out on grants for that, and also to figure out, so we're ready, how we would do that. You know, I presume that there is a treatment center here would be able to collect samples from it.
Yeah.
But we would
They
need
have
to
to
know
do
sort
that.
of what we're ready
Except
to
for the
do.
fact that we have how much percentage of on-site sewage treatment
still
for.
is going
It's a
to
surveillance
It's a-
tool.
It
It's a
is,
surveillance
but
tool.
you know,
Yeah.
with rural,
Absolutely.
really rural communities, your numbers. are
Yeah.
not
Rebecca,
gonna be
has
very
DPW
high.
Wastewater testing is
thought
for a
about that?
region typically, yeah. But
Okay, not that my opinion really matters.
It does to us.
Well, to the DPW superintendent, who's also my husband.
Oh, well, there you go. There you go. Yep.
But I did tell him, I'm
Live
like,
with
we
that
really
one.
need to start thinking about this, and he did say that he has an engineering study or an engineering program happening to figure out how that could happen,
Great.
and not just
That's
with
great.
COVID at the wastewater treatment plant. But again, I did put in my 2 cents with ARPA funds and how to spend them for public health to the town manager and the town
Nice.
planner to appropriate funds for wastewater disease
That's
surveillance.
great. That's
So
great.
That would be
I
really
think
It's a
helpful.
really good location to do that, I think, regionally, sub-regionally.
Yeah.
and
Yeah.
knowing about grants that could help supplement that funding or that sort of program would be really helpful. And then also talking points to give to the select board and the town manager, like, this is really the future of surveillance, and how we pick up on these diseases before they're
Mhm.
in the red in terms of what how CDC categorizes problem
I think Great
diseases.
Barrington would be a really good indicator for South County.
Well, yeah, but I mean, I think even though there's smaller towns out here, there's a number of wastewater treatment plants. They
Yeah.
should all have this.
It's not
Because it's-
expensive technology, truly.
No, and
really
it's
isn't.
your pre-screening that all the
Yeah.
others, if the other sampling, is taken away of individual people,
Yeah.
that's a great way. And
Right, 'cause you have
the
Stockbridge, you
numbers
have-
start going up before it starts showing
Exactly,
up in
early
sickness,
indicator.
never mind the hospitals, an early indicator. So if it starts showing up, then you can trigger some more rigorous testing on a
Yeah.
personal
Or
level.
public health
And it should just-
policy, yeah.
That's a beautiful health monitoring
I think
monitoring
this
policy
is
should
going
be
to
in place,
happen. You know, I think this is gonna happen.
regardless of
Yeah.
size of town, wastewater treatment plant. And granted, there's a lot of on-site systems, but still, there's enough of a read, in my opinion.
I agree.
You're capturing some of the community at least, and
Right.
you're gonna get an idea of what's happening.
Yeah, that's true.
It'd be really helpful to figure out what the staffing capacity would be needed and the cost for obviously processing the test, because if we could find, I know there's DPW and the wastewater plant's not kind of like my jurisdiction, but like, if we can like keep our eyes and ears peeled on possible grant funding
I
to
didn't
help.
talk to Bill Ingram, who's actually the wastewater treatment superintendent, but just talking to Sean a little bit, he said that it doesn't seem like it's too extensive on staff. It's really just one test, and they can test in that one sample, they can test for a variety of
Oh, wow.
diseases.
They already
It's just
test.
having the,
Yeah, they
it's
do
just
already
having the
test a lot of
biological
stuff, yeah.
technology.
That's right, yeah.
That's probably
That's
the most
the-
expensive piece.
So maybe the next thing I'll do is
Okay.
I meant to do this 3 weeks ago and Dr. Brown brought it up at the DPH meeting, but I was waiting for the next week when she would bring us more information. She said, I know other towns are interested, so we're gonna bring you that information. It didn't come. So I'll reach out to her and just see if we can get like a more direct way to be alerted when that happens, right?
That's a great idea.
So,
And then also I was trying to look on Pittsfield Health Department's website. They don't post their biobot data anymore. How can we get that?
the state has it, and I
Um,
don't know the website, but I will ask Dr.
Yeah.
Brown the same thing. I know that all the sites where the grant, that's happening with CDC funds, it's all there, so.
And Ricardo, like I can,
Hospital or?
no, it's Ricardo
Health
Morales, their Department of Public Works Superintendent.
Oh.
He's like very number oriented, so he might be able to point us also in the direction. of like, you know, if
They have a
there's a
nice
delay.
chart.
Yeah, he has a really
Nice
great
little
chart,
graph.
yeah, if we could find it.
I'm sorry, one last question on that COVID update. Amy, you said there are no resources for N95 youth masks.
Yeah,
So what's your plan? How are you gonna get
Amazon.
them? Okay.
Amazon. Yeah, and
Amazon,
when I got a
okay.
message, I got another message back from Anne Marie Stornock at Desi, and she said, if you're looking for help with sources, call me. So I have been doing the Amazon research, but I will also reach out to her and see if there's a cheaper, but I'm looking for, I'm looking for something that kids are gonna wanna wear, I'm thinking of in particular.
You know, the ones that we got sent out to us,
Yeah.
I don't know if anybody here tried them. I gave them out and they all said, they couldn't even get to straps on their first.
Yeah,
pair.
they're so small.
So they're so small.
Oh, the itty bitty ones?
Well, they were the children's size.
Yeah.
And so that's one thing that, I don't know, you have to almost order samples
Well,
to
unfortunately,
see how big they are.
Yeah,
Because we need these to go up through, 5th grade, 6th grade.
right. So we secured 2,700 KN95s, and we can get more. There are plenty more at MEMA still, and we can get them.
And there's pallets and pallets and
Yeah.
pallets. of
Right, but are
tests.
those the ones that are really tight, or are those just the
No,
N95s?
No, so they're both tight. The KN95s are, they've been tested independently at the MIT lab. They're 93% effective. The
Okay, but
particular
they're-
KN95, they go around the face, and they are, I had Jason try them on at Tri-Town. They fit a variety of faces. The N95 ones in the MEMA stash are smaller, and in the messaging I have for the distribution, it's for a smaller, narrower face. I can wear them just fine, but I have a longer, narrow face. The and those are 95% efficient.
Those are the youth ones?
There are no
no,
youth ones
Okay,
whatsoever.
because the
I'm
youth ones that
differentiating.
we got are just,
Okay. They don't have youth for us, and they say they've never
Okay.
heard of a youth N95. And the unfortunately, the guy at MEMA says he's never heard of a youth KN95, which is all over Amazon. So I don't know why he's saying that, but
I
anyway,
have 6 of them in my house.
yeah, I don't know where that, whatever. But so
Okay.
we're distributing them with clear information about who could fit which one, but then we're also looking at, an N95, even though it fit a youth face, would be very uncomfortable to wear all day at school. So that's what we're focusing on for the youth and children, colorful KN95s that they can wear
Behind
at
the ear.
school. They go behind the ear, not the over.
So Amy,
So anyway.
I know you said that you're working with people to find resources where you can purchase these. It'd be wonderful to see if there's like someone on the state vendor contract list. We could purchase some, that'd be a lot easier, because Amazon makes it really difficult. You have to like purchase, then get reimbursed because the town doesn't have an account or anything.
Well, that's what I'll ask Anne Marie, but from Desi, but they have never distributed youth KN95s to the schools. When they did their distribution that first summer, right before they tried to reopen schools in the fall, it was just the surgical masks that were child size, and that's all the schools have ever been given.
And I'll tell you though,
know.
some of the supplies that you distributed from BCB, wherever they came from, the Lennox and Lee schools took all the smalls. So I think there's a need for that. So I
Yeah.
guess the point is
So
that,
child and youth.
if
are
we can
the plan.
find a supplier, depending on the cost, we may be able to purchase some for the collaborative.
Well, I'm actually going to use funds from the vaccine equity
Oh,
grant.
okay,
This is
even
not
better.
collaborative funds,
Oh,
but
perfect.
because we're part of the equity grant, I just want
Oh,
to bring
great,
that, like you
okay.
guys know, we're trying to address
great.
this in all of our districts. And
Okay.
in particular, the survey they will go out, we'll have people reach out to us so we can figure out what their need is. And then make sure we match the supply to the need, and not
Perfect.
just be throwing stuff around if we're purchasing it with those funds, so.
I have visions of, Mardi Gras
I know.
in Mount Washington, just driving down East Street, throwing them out the window.
Right. Well, it's so interesting, compared to other countries, the US has not really done any sort of sustained distribution
Oh,
of.
why are we surprised?
I know,
Mhm.
but I mean, even now, like, if you go online, then you can get this 2 tests sent to you in 8 weeks, but in other all around the world, weekly distributions of this many masks for this person, this many kits for this person.
Yeah,
Here's how to use it.
It's amazing
here's
how
when
they
to
make
use
it work, isn't
It's
it?
crazy, but that's my vision and goal for South County.
Yeah,
That,
That's what helps.
we could do that,
Okay.
blah, blah, blah.
Okay, program and grant updates, FDA grant update.
I just had like one more thing for the nursing stuff. So one of the things that Amy, Jill, and Jane have been working really hard on is we showed a little bit to Mark the other days,
Mike,
some of these supplemental projects and priorities that they'll be reaching out to you on. But one of the things, and I brought this up at the last meeting, is as we start to develop like an annual report for the collaborative at the end of the fiscal year, we'll start to think about that. But, you know, Amy does this like awesome COVID dashboard that makes people like me understand it.
Yeah.
With a narrative, you know, as we evolve, hopefully away from COVID into like normalization of like what we need to do, you know, provide some feedback and thoughts and ideas on, you know, whether it's we do a monthly or
What you wanna
quarterly
see.
kind of goings on report with communicable diseases, what would be beneficial to help you. And I think those kind of reports will also be helpful when we start to present some of this stuff to the select boards on things that this is what the collaborative is doing. You know, these kind of like visuals and stuff. So just, those are just my thoughts and ideas as the three of you start to develop the next phase of like reporting out to the board of health.
yeah.
Provide them feedback of what would be helpful for you.
I think it would still be nice to get COVID updates going forward, even if our numbers
Yeah.
remain low. I don't want, you know, us to forget about it, you know.
No,
I think
no.
There's still going to be seasonal spikes.
Yeah.
And it will just be nice to have that data once in a while.
Yeah, because like I remember when we had our contract with Porchlight, and I've seen some other contract, you know, the whatever the updates are, quarterly reports. I saw the VNA ones too. They were like, there wasn't much substance to it. It was like, it was a Excel sheet of all the probables and confirms, and that was it. And so I'm hoping that, you know, as we evolve and kind of get back to normalization, we'll be able to provide the collaborative membership towns something of value that you kind of see what's going on.
Oh, perfect.
So just be helpful.
Oh, much better.
How old is that
Sheep
puppy?
puppet from behind. That's the person, I mean, a dog.
Just a year old, like this weekend,
That's
actually.
a big dog, but
Still
a
a puppy.
I needed
Pup.
Sorry.
but provide,
Yeah.
you know, provide us updates on like things that you would like to see that would be helpful for you.
Like, it's just as a monthly, I think like as a monthly format, that's extremely helpful because, I mean, I know the COVID ones are weekly now and it's just like part of the stuff, but I take the latest one into our monthly board of health.
That's what I do too,
Great.
yeah.
So
Great,
monthly.
just have
Okay.
that summary. So.
And I encourage them to read the narrative that you send. Because they're so used to looking at a chart. And I'm like, no, you really, to
What's on here?
understand this
Yes.
or have
Right.
perspective,
Yeah.
read this, and boy, you know, it's like fifth grade, because I stand there and I read exactly what you
Oh,
wrote.
that's funny.
But it's, now that we've been doing
Town
that,
manager.
So used to
people
it.
are really paying,
So I
it's
think-
enormously helpful.
Mhm. When I first rolled those out in East Hampton over a year ago, I accompanied it with a 5-minute video. Having to learn how to
Nobody
do
will claim that you're not thorough.
Oh my God, it was awful.
All right.
So, just in the interest of time, I'm just gonna blow through these grant updates if that's okay. So FDA, so I need to touch base with New Marlboro, Sheffield and Tri-Town. We're gonna get those grants ratified. So one of the things I'll be asking the towns is like, if you guys have the most up-to-date 3-page inspection form and looking at possibly purchasing a bunch that would just have collaborative on it. And then we could just write in the town. Do you know what I mean? So that will be something we're gonna talk about. So even, because the Tri-Town application had other towns in it. So for training and also for some supplies as well, because we didn't do the full, the one big one, the 3-year big one. So,
Pat's coming in.
okay, Pat.
And Brandy, just so you know, we got an FDA mini grant for Otis as well that you'll be reaping those benefits as well. I'll talk to you about that. It's a reimbursable grant. So if we do some trainings for Heather and whatnot, we'll be able to get some relief from funding for that.
Yeah, and the thing that I'm really happy about these grants is that the money goes into the town to help with their budgeting of their staff, which is something that I'm really excited about. The opioid working group update, a lot of stuff going on there. I'll send you guys the notes. One of the things that I am actively working on is trying to, so this is an ADA compliant outdoor sharps disposal bin that can go right at your transfer station outside. And so I'm working with also the company that would pick it up to see if we could get like a group rate. So I'll be bringing that to the collaborative to see which towns are interested. And if the Board of Health people are interested, how the best way to then sell it to whoever's running the transfer station.
Is that Stericycle that we use? I remember, and one of the things I want to put on in the parking lot, and I brought this up before, is like, years ago, I worked with Laura Kitross on trying to come up with a countywide sharps collection program. It was just very difficult because Stericycle, they weren't very municipal friendly. And I remember back in, for those that have been around for the longest time, when we first got those sharps containers, one of the biggest issues was for the towns is sighting of it. Because if it's outside and it's full, people are just going to drop sharps on the side of the road. And but it was really the costs associated. You know, the state's going to give you the kiosk, that's great, but like, who's going to pick up the bill for getting rid of the sharps? I'll be really interested to see if they'd be willing to come to the table to have like a lower rate. So I think we need to make sure going into the boards of health, they understand what that cost is.
Okay, so harm reduction program, though. If the towns go in with the harm reduction program, they will pick up sharps, they will pick up.
Oh,
Yes.
okay.
So I hate to preempt you on this. You know how I feel about this.
No.
Transfer station, as a transfer station attendant, it is not fair to ask them to handle it. It is just not fair. And yes, they do get dropped. They get shoved everywhere. They get put in the garbage. The deal is that the van will come around monthly.
Oh, no, okay.
And people can pick it up and it's at no charge.
So, I mean, so maybe that's the route to go. And, you know, and I have talked to Sarah DeJesus about in the Southern Berkshire communities, being there when the van comes to like, you know, kind of look at possibly, and, you know, maybe having the nurses like set up a table there so that we can give some resources out as well. So maybe that would be the thing to do. So
I don't think you should stop pursuing that. I think all opportunities should be looked at.
Offord is definitely doing this.
Yeah.
And then Juliet's on here. I've talked to Juliet.
They won't after they start getting them piled up on the side. I'm telling you, that's exactly what happened.
Okay. So you've had this.
We've had this happen. We've had this in other communities.
And that's one of the reasons why Tri-Town never, and by the way, we're still listed as a repository on
Well,
the
I know
DPH
people
site
keep coming.
after years and years and years and telling them we don't do it.
Okay.
And we don't collect it. The household, every town here is part of the household hazardous waste program
Right.
in South County. Clean Harbors doesn't take that.
Right.
We have had, there is some validity what Ellie is saying. That's always been a concern, you know, placing it indoors, training, you know, what happens when you get a needle stick. And we have actually had people drop off big wide plastic bags without even having one of these at our front door.
Yes.
I know there totally is validity to what you're saying, but I wonder if historically there were so few
Maybe.
places to drop off
Maybe,
these sharps that the one place in a 50-mile radius was just getting bombarded.
Right.
And now we're seeing the harm reduction van getting approved. There's a harm reduction facility in Great Barrington that's opening. There's the recovery center. There's the 2 at the hospital. And then if we do have them at our transfer stations, that's just adding to the list of places.
Okay.
So
Yeah.
I wonder. That's what
I'm not
I-
about this, but the people who are manning the transfer stations are not trained. They don't want it. They
Well,
don't want it.
Well, you're saying that, but Alford's wants it.
Yeah, did they talk to the person who's
Yes.
doing it?
Yeah, TJ Horrington's the one that like got me. So you're speaking on your behalf. And here's the fact though, is that we have diabetics, We've got all sorts
That's
of
right.
people that have these sharps with no way. So if we
Yeah.
put forth, like, give everyone the containers, give out the information, I think it's worth trying, not in Mount Washington, but in other.
No, it's not just for Mount Washington. That's what concerns me.
Right.
As you just said, we've got all of these things that are beginning to open up.
So it's hard, but we still have
So
to try
let
to
them
do it.
use the hospitals. We've been trying to return them to the hospitals for years.
They won't
So,
take them.
and they won't take them,
No,
but
They will
now,
not take them.
Bring them
They
to the
will.
outlets.
So here's the thing, here's the
Jane,
rub, because we
we're
were
done.
No, we're not done.
changing my mind.
That's fine,
No,
I'm
no,
not
that's
trying to
fine.
change your
You don't
mind,
have to.
Ellie, but I am speaking up. We'll do it, yes, thank you. And then, but then the other thing is that the hospital does now, and Rebecca was part of that effort to like put it in the emergency room, but we were bound and determined, or they said, you cannot advertise. So, yeah,
Yeah, they
no,
were
there's a
bringing people
resource
out
that
there.
no one knows about. So, because they don't want to be the one place within. So if that's gonna be part of the conversation when I come around, if you want it to pursue it, I can give you information about it. If you don't, that's fine too, but I think we need to figure out.
I mean, you should
where
definitely
people-
pursue it, just, it's important to get the transfer station feedback and make sure everyone's comfortable with it. And maybe some resources on what happens if someone
there's
drops. Yeah,
Well, there's training that someone has to do. So
yeah,
I'll bring that to you.
yeah, yeah.
And looking at time, I'll, vaccine equity grant, that's kind of just a placeholder. Sounds like Amy has been working with Fairview and working on maybe getting some resources there. That's great. Is there anything else that you want to say on that?
They're thinking about using the bulk of this fiscal year's funds to support or offset the cost of summer camps for working families. So they don't have
Oh.
a program yet developed. In the longer term, they're looking at funding a sort of a really comprehensive data project to get at the kinds of data that we're not able to see when we look at sort of these larger collections. We don't have good demographic data in terms of like even just household income, right? It's so skewed in South County in particular that it really hampers our ability to both determine our needs and apply for grants. So there's a longer term project around that, sort of under the guise of how the community's been impacted by COVID. But essentially it's how can we get ready for what might come next, with finding what are our sort of weak points. So
Amy, are they gonna be working with the camps directly on this potential?
there is, I've heard no details.
Okay.
I just know, I came in hard pushing for focusing on our high-risk community members with all of the mitigation of COVID lifting. And I predicted, I knew that grant cycle was ending for Stop the Spread at the end of March. And I kind of assumed it was gonna go away for everyone, but it, as it turns out, not everyone. So I was coming in hard for distributing tests and high efficiency masks, but it kind of got, we're gonna look at impact on families and especially working families. So.
Because the boards of health have contact with the camps, that's all I was only asking. the
Yeah,
permit holders.
I'm imagining it'll probably be a fund people apply for, but I do not know. Or maybe they can work with the camps to get some scholarships within each camp. I don't have any idea.
That'd be cool.
That makes me so happy
Yeah.
because our demographics are totally skewed and, families, working families, people that aren't in that upper percentage of income do get forgotten and it just makes me really excited.
And
that
we rely
we're
on
looking
camps
at
for daycare, by the way. for
Yes,
working families.
absolutely.
Absolutely.
And camps still have not come, DPH still has not come out to say whether or not they're gonna have updated camp guidance this year, which I tend to think they probably will, but the fact that they can't just tell the camps is impacting their ability to hire staff, like, because if their ratios are gonna be different, they need to know. And so
My understanding was.
they're doing the hiring now and not a great hiring market.
I don't think my gut tells me there's not gonna be any guidance.
That's was my understanding from.
I could be
DPH.
wrong, but
They are not planning on giving any further guidance.
So my last correspondence was last week with Carrie, so maybe
Right.
things have changed in the last week.
Well, maybe, but I can tell you the camps are not
Do you-
thinking that there will
do you
be.
anticipate some guidance coming up? for
No,
camps?
but we do I have people emailing me asking, and so
Interesting.
I had emailed Scott and Carrie to see.
I just don't know how they would be able to justify
Well,
that.
see, Camp High Rock is like, we're not we're not doing anything, period. They've been told that, no, they're gonna go back. They were told early on, back in January, that DPH was not planning to do anything, and they went forward
Yeah.
assuming that. So if they
I
turn
think
around and slam them in April,
Yeah, I don't know. I
Yeah.
don't know what my thought is on that, but
Well,
Anyway.
let's keep our ears open, and
Yeah.
maybe we could share.
yeah,
Wow. So, and then, can we, so the share folder, was just kind of one of those things, we're still kind of,
we're kind of stuck in the mud with either Dropbox or Google Docs, but I haven't found anything else. I mean, we definitely need to work on that though, because I have tons of resources I could share with this group, just in my own folder, doing housing, septic, camps, whatever. I just, I need to get an external hard drive and share that with you and whatnot, but I mean, we can try two different platforms. I can send out like a Dropbox thing and a Google Docs and see, we can play around with it,
Which
see what
one
works and what
uses more?
doesn't. What's that?
which one people use more?
Well, I mean,
or
it's
like if
more-
you have trouble with one and not the
Not
other.
the other. I could try Google Docs folder and see how, do a couple samples and see how it goes. It's gonna be a couple weeks, I'll deal with that.
Does anybody in your town have a program called SharePoint? Have you ever heard of SharePoint?
So I do, Mike, for our mass and motion tobacco grant, we run SharePoint, but it's not spread out to the collaborative.
Right.
Right, it's a
Okay, 'cause we're-
Microsoft product, right?
I don't know if it's
I
Microsoft.
think it is. Yeah, it is a Microsoft product. It's years ago, our tobacco program, the tobacco control program, we did everything through SharePoint, documents, resources, regulations. We even did our budgeting and expense reports on SharePoint. They backed off on that. Mass and Motion still uses it, but it's a very comprehensive system, and I would love to use SharePoint. If that could be a way to do that across the collaborative.
We're doing that on the islands where we're going with Nantucket has SharePoint. We're going to use their account. I don't know anything more about it or less about it than what I've already said. I know nothing about it. I know my concerns are, number one, that everything that you generate is subject to the public records law. You have to keep that in mind.
Yep.
So you might, and so anything that comes between your boards is all fair game. And then you also have a nursing component, so you have confidentiality issues on some of it. So make sure whatever you're using is pretty well protected for those two reasons. Just a sort of a little hint, a helpful hint.
Maybe we can use the ARPA funds that are coming to purchase that technology, because from what I know, Google Drive does not have a lot of capacity or storage.
SharePoint's
very
good.
limited.
SharePoint's really good. Like, for example, I don't want to belabor it, but like DPH would put all the new state tobacco regulations in there and everyone had access to it. There's a login, we did budget stuff on there, but it's a secure Microsoft system. Sure, it would just be a matter of licensing and teaching people how to use it.
I mean, we're just talking about fact sheets and.
Yeah.
sample
Right, we're not
correction
talking about anything that
orders.
would
Yeah.
be privileged information anyway, so.
All right. And then community partner updates. I did want to add one thing to community partner updates. So we had South County organization or town that, should I just say the name?
Say it. I mean.
Okay, so-
nice.
So Sandusfield contacted us and they would really like to be part of our public health nursing. They're like clearly in South County. There's a few towns that aren't in the collaborative initially. And Sandusfield is one of them. So my question for the group is like, what do we want as the process to look like? I mean, on one hand, we don't want to we're not actively looking to expand our collaborative. On the other hand, they're in South County. They want to be part of all the stuff that we're doing, so, and it makes a lot of sense geographically. So my question to then the board is like Sandusfield, I mean, even Tyringham is part of the Lee School District, we weren't able to get a commitment from them. And I know there's been some, there's like some interest there. You know, what should we do as far as like moving forward with some of these smaller towns that would like to be part of the collaborative and benefit from what we're doing?
Well, and I'll just,
Can I make a comment about that?
go ahead, Pat.
Yeah, first of all, I apologize for being late. I got messed up in a few different projects at the same time. But it seems to me that joining in the future as actual members is a great idea, but diluting what we have now, which did not include them, is problematic in my view.
Kind of on the same side as Pat. I don't mean to be exclusive. I think this is a wonderful resource that we should expand to as many people as possible. But I know that when we had our conversation initially, Jim, like a year ago, part of what was so attractive to me is that we had more nursing capacity for fewer towns.
Right.
And again, as Pat said, diluting that further, I think strips us farther from that initial attraction to why this grant was so wonderful. But I think as we build capacity and maybe revolving funds or our bank account gets bigger, we can provide more services to other towns. That's just, but like, as you know, we had this conversation with Juliet a couple months ago.
Yeah.
I don't think there's any problem in having Sandusfield at the table and benefiting from our extracurricular programming.
Totally agree.
But
I
that's
mean,
just my initial.
I mean, we're a 10-town collaborative, and you're right, Rebecca. I remember us having conversations on a Sunday in the
Yes.
spring, way before the grant was even thought of.
Yeah.
Just putting our heads together, like, this is what we need to do. I'm not in favor of expanding either. I'm very sensitive to Amy and Jill and Jane being staff now, their capacity to serve the 10-town collaborative. Even if we get to a point of expanding, I don't care how small the town is, very little Maven data, whatever, it's probably not a lot, but like, we would need some extra funding to figure that out. In Sandusfield's case, it gets a little bit more complicated because, you know, they are an alliance town and they have a current contract with the alliance to provide whatever that they're doing, probably public health, nursing, and maybe whatever. And I want to be sensitive to that. And that's what I kind of said to Sandus was like, well, you know, I'm not into shopping who is the best program to be providing you the services. Although you're in South County, we're hearing what you're saying, that you want to expand services as well. It gets a little bit complicated, and I don't want to be portrayed as like having towns shop around for the best deal, you know what I mean? And we want to be sensitive, you know, to Berkshire Regional, and if you have concerns with your contract, you should go to them, you know. But we need to be very careful because I want quality, not quantity, and I just want to be sensitive to that because we're still up and running. You know, we got to get this IMA signed and whatnot. It's not an exclusive group, it's a public meeting. Maybe we can invite other South County towns, remind them when our collaborative meetings are, but like, I don't think we're in a position yet to be expanding, although, you know, we should be thinking about how that looks like down the road. So I agree with Rebecca and Pat, but part of what we're doing is to bring these things to the table and, you know, not make decisions based on one person, but like, we hear you, you know, you are South County, but it's a tough.
Jim, can I just pitch in here for a second?
Sure.
In the past couple of days, Cheryl and I have been meeting with Sam and his staff, and we have another meeting coming up next week. This is what the map looks like right now for public health grants across the state. And I'm going to zero in on Western Mass.
Keep going.
Okay, so we have New Ashford, Hinsdale, and Tyringham, and somehow Sandersfield has escaped everybody's notice because they're colored in blue as if they're a member.
Well, they're
No,
probably
yeah,
written
so
into the
Part of the
alliance.
Health Alliance, they are. They
Okay.
are, the Health Alliance is
No,
great.
but these are people who are committed on the grant. These are
Part of it.
Town of Sandusfield is part of the alliance.
So he's
Okay.
talking about the grant.
Yeah.
Yeah.
They
Mine says
also-
grant.
They
Are
are
the
the grant.
grant.
They also
But are they Are they getting the same services that the rest of the Alliance is getting through the grant?
So let me just quickly, let me bring this back a little bit. So we wrote, and this is where I think long-term, we got to kind of sort some of this stuff out. We wrote a 10-town shared services grant for this collaborative. We're providing all the services to the towns. But at the same time, and this is where it kind of got a little bit tricky a while back, is Berkshire Regional Planning, the Alliance wrote the same kind of grant and included some of the other towns that are covered, but they're not providing direct services to. So like you would have to talk to Laura on what services they're providing their specific Alliance towns. I don't know that, but
Right.
and that's why, you know, Jane and I were advocating with Rachel and Jeremy a few weeks ago is, you know, we're trying to advance our IMA through our collaborative, but when you go to the DPH site, there's nothing on there. And so then it also gets confusing too. You know, Pat could speak, there's like Sheffield's a major part of the collaborative. We're providing all the services to Sheffield. But then there are some towns that are under the Alliance that aren't really getting all the services either because they don't have a contract. It gets really confusing.
Like
So-
an example, Mike, is Alford, okay? Alford has never gotten any services from the Alliance, I think ever. But certainly in Mount Washington, the same thing. We were included under the Alliance application, even though there was no benefit. So for Alford, we chose to just withdraw from the IMA just to make it so that it was less confusing for the state. It's going to take us a year to do that. And so in the meantime, they're going to continue to apply for grants under Alford's name, even though we're not benefiting from them. So it's just messy.
Okay, so what I've been tasked to do is to bring Tyringham into your group. And because we have to fill in all the blanks across the state. It's going to get very challenging when we get to the 128 corridor. But New Ashford is being talked to with, apparently Laura is going to pick up New Ashford and Hinsdale. Tyringham seems to be in your catchment area, and I'm supposed to be asking them, and I have not spoken to them yet, but asking them what we can do to get them into your group. But I wanted to talk to you before I ask them that question. It's kind of like which comes first, the chicken or the egg. But I am also in a position to tell you that we can get you more funding if that's going to be the issue.
So I want to wrap up the meeting, but let me just explain the Tyringham issue. I know Tyringham really well. They're part of the Lee School District. So Lee and Tyringham is the Lee School District. Now they used to, so they're not an Alliance town at all. Tyringham they're on their own little island. And I know, although I know them really well, but when the VNA went out of business, the Alliance picked up the public health nursing contract. And so I know I have been communicating with Laura, and preferably I would rather have us cover Tyringham, because you have the Alliance covering one half of the school district when another program's covering the second half. And I did talk to Laura about that. And I did tell her it was a little bit awkward that why we wouldn't be providing, were we gonna do a flu clinic for half the school and then the Alliance does the other half. However, Tyringham is very independent. And one of the things, and I'm putting my Tri-Town hat on for a second, we have to be really sensitive before you start telling towns they have to be part of a collaborative, because up until Sam Wong emailed that to me several months ago, I had never heard of that philosophical approach, Mike, that a town needs to be part of a collaborative. You know, you got to be very sensitive when you go to a town and say, well, you need to be part of this collaborative, or you need to be part of that collaborative. I just want to go in. I'm not going to, we've communicated with Tyringham about what the collaborative is and what benefits they can get. You just got to be really careful going into coming from someone who's run a health district for a long time. We're 95 years in. You can't just start we put this collaborative together based on conversations and a willingness for towns that want to do something different and expand services. not that they were forced into a situation. That will fail miserably.
Okay,
And I'm gonna push really hard on that. And I said that to Sam, that I had never heard of that approach. You know, I know you look at Berkshire County, there's a couple towns missing. I don't really care. You know, when am I gonna get $3,000 for Terringham? Terringham knows that we have the collaborative, but they're an interesting town. And I mean that with total respect, but they're also independent and they're really, we work with them with our household hazardous waste. We do their water
Yeah,
testing for
that's
them at Tri-Town. But you can't just tell town A, hey, you need to pick one or the other to be part of this collaborative. That's a tough philosophical approach that I can't get behind.
okay. If they are willing or interested in joining a collaborative, would you have them?
Well, yeah, we would have to, yeah,
Well,
absolutely.
that goes back to the conversation we
Right.
just had.
So, and I have a question about that. Is it possible, since we're the original towns, right, with this public health nursing part, that any town that joins after that would not be a part of that, but would be a part of everything else that we applied for? You know, this has actually been committed. I have to say, I agree with Pat and you and Jim about the fact that one of the things that will really sink the boat here
Mhm.
is if we start telling people we don't have the money we said we had.
Yeah.
Well, I wonder if
So
you just gave me ideas.
is it a step, maybe it's a step kind of thing that, oh, God, I'm sounding like an insurance company. I'm sorry, you have a pre-existing condition. That means that, you know, maybe this part is not available to you under this current funding.
Mhm.
When our funding expands, we have no problem putting you in. on
It's
that.
about the funding. It's really about the resources,
Yeah.
folks. It's, you know, like, look at, like, evolutionarily speaking, we last forever. Ideally, it would make sense to have all of South County having part of one collaborative, right? But with that comes resources that are going to be needed.
I wonder, you probably have a lot to say about this, so be honest. But what about any town that wants to come in to receive nursing services or receive services? It's a contract and they give us their nursing
Budget.
award or their nursing funds.
Oh.
Is
Well, I
that,
can envision, I have trouble with strong thoughts about this
Yeah.
also as the one providing the services. And with a public health background, frankly. It hamstrung Jill and I an enormous amount to have gaps in South County access to Maven data during each of these surges that we've been present for, the Delta and the Omicron surge. We observed very different ways that the Alliance nurses were responding and communicating information both to their population and with us and with the schools, which made it really hard to do our job well at times. And, you know, I just often felt like I was banging my head. Like, I really would like to have Sandus filled in, because when we had, for example, at the end of the summer, the
State roads.
the state, I mean,
Max Trail in.
half of those cases were in Sandusfield. Sandusfield had a quarter of all of its COVID cases in a 1 week period of time. And no one was talking to Sandusfield. And we had no idea because we had no access to information. And all those people were directly connected to our Otis population that was getting COVID. It was so frustrating. I feel similarly about Terringham, again, because they go to the same schools and they're very interwoven with Monterey and Lee. It is really, really hard to do comprehensive public health nursing with big gaps in your coverage area. I have an idea that there could be an affiliate membership, maybe, I don't know if that's a good word for it, but they can come to our meetings, they can be considered when we are writing for new grants. And then we wait for the next fiscal year cycle where they have funds available to
Yeah.
put into our public health nursing pool of money. But let's bring them in, and frankly, if they want to be affiliates with us, I really want Maven access. I may
Okay.
not touch it, but I need to see it. And that is, I think, going forward.
So we would
what
have
need
to talk
do.
with them about what outside resources they would have. I just want to be sensitive to your time.
Of
Because, you
course,
know,
yeah.
I don't want to be the person say, Jim, you're giving me too much. And I totally agree. I mean, but like, I think, you know, when we're meeting with the Alliance on a monthly basis, just so everyone understands, like Laura, myself, Rebecca, Pat, Jane, and their coordinators are meeting on a monthly basis. But one of the things that we gotta try to resolve is trying to communicate these two programs at what makes the most sense. For example, Emily Jarrett just retired. Richmond and West Stockbridge are South County towns, and they had already signed a contract with the Alliance without any conversation, to see if we had capacity. We possibly could have helped West Stockbridge. And so I think we got to get away from this territorial thing and figure out what makes sense for all the towns for comprehensive services. And so there's a lot of things to sort out there, but
And just to say, West Stockbridge is an example, they're in the catchment area for the Berkshire Hills District. And so that's another example. We're not providing services to West Stockbridge, but we are serving the district where all their students go. It's very awkward.
it is
Very
awkward.
Very
It is
hard.
I think
awkward.
Pat had a question.
Well, I just wanted to comment that I think we need to get away from the notion that what these towns had budgeted in the past for the VNA would be adequate for them to dump onto us, and that would give them services. It was a pittance. And when you talk about what this service actually costs, it's irrelevant. It just doesn't come anywhere near. So
It doesn't.
I don't want us to think, oh, well, if they'll give us the VNA money, we're cool. We're
No.
nowhere near.
And Pat, how I would envision it, we would have to engage Sandusfield, sit down with her and say, what are you thinking? What do you want? And then we'll have to come back and say,
This is
we may need X dollars that you're gonna have to budget for the new fiscal year if you want us to provide X and Y services.
My question for Mike is, like, as you guys are trying to knit together these types of things, and is that something like, that, do you think that the state is sensitive to that? Like, for instance, if our public health nurses, we don't want to dilute our public health nursing program by accepting more towns and doing what actually does make sense, that the state would consider looking at supplemental funds until.
Absolutely. No, absolutely. There's,
Definitely.
what I'm coming to you with is not just something we're trying to cram down anybody's throat. That Sam has told me that whatever we're asking for, there will be adequate funding to make sure that it works. So if you say yes to Tyringham, your money will go up, and it's not $3,000. We're being realistic. If this triggers the need for another nurse to be hired because you are now at 100% capacity with your existing grant pool and you're pushing it, I can go to Sam and say, hey, look, Sam, they need enough money to hire another nurse to add Tyringham because they're already stretched to the breaking point with what they have right now, and Tyringham will upset the apple cart. It will get you more funding.
And Mike, and I'm gonna ask a very difficult question, and I'm gonna try to be as very sensitive as I possibly can without disrespect.
Don't worry. I'm not the state.
So
Remember, I'm your advocate.
So, for example, and one of the things we sort of talked to Sandusfield about how complicated this is, they were written into the Alliance grant, right? Plus they're contracting out for public health nursing. And one of the things I was trying to be super sensitive about is like, well, say for example, you want us to do, can we capture some of that money to help Sandusfield offset the cost to provide us? It gets really complicated when other towns are written to another grant, but they don't have the money for us to take them on. And that's where it gets really complicated. I said, well, you're gonna have to go back to the Alliance and talk to them first, but I really agree. Amy and Jill had a very difficult time, and Brandy just texted me. She's the town manager in Otis. Sandusfield is one half of the Farmington River School District.
Oh, there you go.
And so like what's happening is we have same school districts running two different Board of Health programs.
And that is the problem. Like, that's a huge
And that's what I
logistical
get
issue.
from the nurses. They'll call me like, oh, they're Sandusfield. Oh, they live in West Stockbridge. Oh, they live in Tyringham. So it's like, and they're not getting the same.
Yeah, and it's just one of those things where I think we have to sit down with Laura and have those kind of conversations, because I would have loved the opportunity to talk to West Stockbridge and say, hey, like say, hey, do you guys have the capacity to pick up West Stockbridge? We were never part of those conversations. And next thing you know, it's off the table. And I think we need to figure out a mechanism to better coordinate. Because to me, it's not about territory. We're doing this because we're trying to better sub-regional systems, whatever.
Absolutely. No, you get it. Everybody knows you get it, Jim. There's no question.
Like, we're not making, we're not trying to add towns to put money into our coffers. What we're trying to do is build a comprehensive system. And we're
Right.
still having communication issues with, there's gaps in South County. But we also have to be very careful where you can't go to a town and say, wow, you gotta be part of one or the other. You gotta be very sensitive to that because people are very independent in Berkshire County.
Well, and then we also have like this list of things that we're really excited to do. And we don't want to have it so that because we take on some extra towns that it reduces our capacity to do like some of these innovative, we've got 4 pages of innovative projects that we'd like to work on. And so that knowing that the conversation has to include like if we could hire somebody, a part-time nurse to make sure that the
Per diem or
current,
something.
the current 10 towns aren't negatively affected by the change. I think that's what
Yeah, you even have staff to help, to cover
Yeah.
the overflow of some of the
Rebecca
stuff.
had something that she wanted to say.
This is obviously a very important conversation, so I don't want to end it now if we still have things to say, but I do want Pat, if I can be so bold as to suggest that we put this on the next agenda and come up with a structure of how we accept new members in the middle of the fiscal year. What does that mean? What's the procedure? Do we first sit down with the town, ask them what they want, have a cost list associated with what that membership or affiliate membership would cost and
And
staff
also,
time?
it's not just this too, it's also this, the synergy between all of the public health leaders from each of the towns. If towns want to join us, I think it's really important to explain that this is also part of it. And if you're not interested in contributing to that or benefiting from that, you're not a collaborative town. Like,
Well, that's part of
we
the-
need you to
that's
think
part of the
collaboratively
interview.
about all of it.
Right.
And it needs to
the-
go both ways. Yeah.
Can I just ask a very stupid question? I can see some people here and there's somebody off screen that's speaking. I don't know who it is. And I just want to.
Oh, it's Amy, sorry.
Okay, so Amy is the synergy lady, right?
Sorry, the synergy
Yes.
lady, is that what he called you?
You should try sitting next to her.
And who are the hands connected to a red sleeve that I can see occasionally on the other side of the page?
Ally Lovejoy, Mount Washington.
Oh, okay. And then next to you is,
Bill Sweet, public health nurse.
okay, and then on the other side.
That's Scott McFarland. Oh, there's Rebecca.
Rebecca Jersey.
Hi,
Okay, great. I'll probably be asking Jim later because I want to be able to just sit, when I have this conversation, just so you know, I work with Mass Association of Health Boards. I'm not from the state. I am your service. And although I carry messages, Sam Wong, I don't know if you all know who Sam is or not, but okay, so Sam and I have been friends for 20 years. In fact, I brought him to Framingham where he ended up leaving abruptly during COVID. And I helped to get him, I wrote his recommendation for the job with the state. We were very, very close friends. MAHB is the Mass Association of Health Boards, and we represent, you're our constituents. And so our contract with the state is to provide legal and operational technical assistance to the 351 boards. I'm the director of policy and government relations. In my past life, I was a practicing attorney for 32 years. So, and I don't do any law practice now. That's up to Cheryl. But Sam came to me as a friend, basically, before each of these rounds, or before rounds 2 and 3, I was sort of pushed into this issue because in a meeting one day I shot off my mouth. I don't know if you all remember Ron O'Connor, who was the director before Sam. Ron made a comment about Mission Impossible is Martha's Vineyard, 6 separate boards of health that don't talk to each other. And when they do talk to each other, their selectmen scream at them for talking to each other. And he said, we're never going to get Dukes County. 2 or 3 weeks later, I delivered all 6 boards of health to DPH and said, they're done. And then he said, yeah, well, you'll never get Nantucket. 1 day later, I got Nantucket. So I'm used to dealing with the issues like the Tyringham issue. I'm from a little town in Maine called Raymond, which is, it's not Berkshire County, but we're Sebago Lake. That's how you'd know Raymond. It's a summer resort place. We go from 5,000 people to 35,000 people in one weekend, and it stays that way for the summer, and then it dries up. So I know about rural life, and I know about the demographics that you guys are dealing with in your area, because you're very similar to where I grew up. And when I see Tyringham, I think about Wyndham, Wyndham, Maine. It's the same mentality. I get it. And everybody, one of the things that we've been very insistent on through the whole public health program from the MAHB standpoint is that you cannot erode the duties, powers, and responsibilities of the elected and appointed board members. You cannot erode those. That's how the DIG grants fell apart, because the state started telling people, you're going to be a district and this is how you're going to act. You can't do that. It doesn't sell. So I'm here. I'm not pushing Tyringham on you because I'm working for Sam. I'm pushing Tyringham on you because I need to find a place for them, because when this big money comes, when the ARPA funding, the $200 million that I went through 4 hearings, legislative hearings, representing all of your interests in those hearings. We got that money, the $200 million. When that money gets distributed, Tyringham is not going to have a conduit to get the money.
Right, I totally agree. Yeah.
Right, and so if for no other reason, we've got to get all of these little gray spots colored blue across the state, because when that money rolls out, that's where it's going to go. And there's 2 cities we've written off, Boston and Springfield, but everything else is fair game. Jane?
Well, no, I think that what Jim had said earlier, that this is the first time we've heard this approach. I mean, personally, as a small town, I really had hoped that Alfred was going to get, $10,000. And I had all my, had all sorts of fun ideas of how that's going to happen. It doesn't seem like the money is going to be able to go to the individual towns, which for the record, I'm not in support of, but whatever mechanism that it comes down the pipe, we need to try to make it work the best we can. But I think that there's some other things in Berkshire County, like possibly Sandusfield, that it would be great to clean it up when the ARPA money does come through. That it's exhausting trying to figure out some of the logistics of all this. So thank you.
And just so you know, while we've been sitting here, I did send Sam and Rachel. Happy Friday, Sam and Rachel. I'm in a meeting with South Berkshire right now, and they're pretty disturbed that the most rural of all rural areas cannot get a stop the spread PCR test. While there will be antigen distribution, they are concerned that there will be no state-run PCR testing. How can we be doing health equity and not have a stop the spread site in Berkshire County? Can anything be done? So,
We're bowing to you.
you don't have to bow to me. Let's get this done.
So I have 11:30 meeting in Stockbridge, but I want to wrap up saying, yes, we should definitely come back to the next meeting. I do have some thoughts and ideas we can bring to the table, bring it to the board, figure out a cost analysis, run it through the nurses, make sure whatever services that they're requesting, then figure out the funding piece. But I do agree what Pat says, not just getting their limited VNA fund, whatever the heck it is not going to cover it. But I think, Mike, at some point, Pat, Rebecca, myself, you, Jane, and even some folks from the Alliance, we're going to have to sit down. And I know we meet on a monthly basis, but this topic is a sensitive one that doesn't seem to come up. We got to figure out a way to work together what makes the most sense for the county.
So I don't forget, Jane, can you bold underline what Amy said in the minutes about also the duties of what it means to be a member? You have to participate. You can't just be out in your little silo town and it's this table, it's this conversation that's also part of it.
I stopped taking notes because I was so engaged in the conversation, but it is recorded. And I will, when I do that, I'll make it I'll keep it, I'll bold and.
You don't have to bold, so I don't forget, because that's a part of what should be.
No, the synergy.
Yeah.
And that's part of what makes this group work, right? Is we all bring stuff to the table.
Mike, will you be talking to the Alliance as well, or is that someone else's territory in terms of this kind of filling in?
We talk to everybody. We talk to Laura regularly.
Okay, so they're going to be warmed up to this idea, or not warmed up, but they're going to be as familiar with your concerns and issues as you've just alerted us to. So the idea of coming together with them, and we do have monthly meetings with the Alliance. There's a forum for that kind of discussion if we're all comfortable with it.
Excellent.
Especially if
Okay.
that we have a third party negotiate, like navigating the conversation.
What, Pat, do you think it would make sense to maybe ask Laura, so we're all comfortable, maybe bringing in Mike to our next meeting with the Alliance to have this conversation? What do you think?
Sure.
I'm happy to do it.
Yeah.
We'll probably want to talk to Laura about that
And Scott has
first.
some thoughts about it as well.
Yeah.
All right.
She's talking to New Ashford and Hinsdale right now, just so you know.
Yeah.
And okay, and then let me just, I'll give you my phone number, my cell phone, if anybody wants to take it down. I don't know if you need it or not, but
Sure.
well, you know it, Jim, anyway. I think I'm on your auto dial. It's 617-448-4888. And my email is hugo@mahb.org. And I don't have a life, so don't worry about calling me. So this is what
point. And Mike, I don't know if it helps or if you know this already, but like the Alliance started a while ago. So there's a bunch of towns that most of the county was part of that. And now there's a group of us that are South County, but there's crossover because a number of our towns like New Marlboro are still part of both, trying to just figure out how this is going to pan out and work out. And personally, for me, representing New Marlboro, it's not about us and them. You know, as two different organizations fighting for a bigger marketing share, or anything like that. Like, let's just make this work. So, in my experience with the Alliance is, well, you know, I'm on the governing board there as a representative for New Marlboro, as is Martin, Rebecca,
Sheffield.
you know, other people who are in this group. And then there's also the town of Egremont, which, you know, geographically, I'm not sure how that's playing out, or if is Julia on the call?
She was on, she's gone.
So there's some bit of transition time here in the weeding out of geographically what's probably going to work better. So that's, you know, why I'm involved in both, with the intent of having both work and both work most productively for their constituents. You know, so Sandusfield, I can see geographically probably is going to, you know, should meld into this group. In the meantime, there's towns that are already set up with the Alliance. Play it out. I don't know. Some of this is going to have to happen over time.
right.
Not long, but you know, I don't know, a year or two. I mean, a lot's transitioned already. You know, as things become clear. You know, talking about West Stockbridge and Richmond. Okay, they were already part of the Alliance. Maybe they didn't know about this group even so much. So education is going to be happening.
Yeah.
You know, the conversation about expanding to other towns for the Southern Berkshire group. I guess I agree with Pat. It's not warranting a marketing effort at this point. I think it's going to evolve in the mid-near term, you know, and it'll work itself out. And that's my commitment to both groups.
Yeah.
Because they both have great people in them working their asses off, you know, and trying to make public health work for the county.
Yeah.
Anyway, thank you.
I'm very sensitive to that. And just so you know, Jim and Jane, the first time I ever met either of them was on issues involving some of the overlap issues. I'll just put it in those terms. There's a certain amount of overlap issues between the South Berkshire and the Berkshire Alliance. And so both Cheryl and I are extremely sensitive to that we've been working with Jim and Jane on a lot of those issues for quite some time. I'd say at least a year now, right, Jim? I guess.
Yeah.
So we're sensitive to that, and there's some tough issues there. There's some very tough issues, and I think that, you know, everybody's working to try to keep things moving smoothly, and I think that that's the best we can do.
Great.
Yeah.
Keep it going.
Because the Alliance really was did provide a solid like a solid base. And, you know, that doesn't mean we can't like evolve, but like figuring out how to recognize that and, you know, and just make it work so that it makes sense and we can continue to just work symbiotically, synergistically.
Okay, anything else? And I have to get going, sorry. A motion to adjourn, anyone?
So moved.
11:15.
Second, all right, no, Mike, thank you for your time.
Thank you. We'll see you all. I'll
It's a great
probably be at your
weekend.
next meeting. So, we'll see. Bye-bye.